Hello, habari, bonjour, and welcome to the Africa Power Hour and the introduction of the Escape Neglect campaign. I'm your host, Nadia Abdallah, and a mentor at True My Voice. Now, today's episode is very, very interesting because we are part of the Escape the Neglect series produced by True My Voice and Devex, and in partnership with Gates Foundation. The Escape Neglect aims to amplify awareness of the NTDs using the power of storytelling, poetry, and localized content. The campaign seeks to address stigma, promote prevention, and foster community dialogue on neglected tropical diseases, also known as NTDs. Magonjwa ya tropikia yaliyopuuzwa au NTDs ni magonjwa yanayoathiri zaidi ya watu bilioni 1 ulimwenguni, hasa wale wanaoishi katika jamii zilizo pembezoni. Sasa magonjwa haya yanaweza kuzuia watoto kuhudhuria shule, kupunguza uwezo wa watu kufanya kazi na kuweka familia katika mizunguti na umaskini. Now, before I go into the questioning, today we have a very interesting and privileged guest, I would say, on my side. Her name is Ruby Valentina Atieno Mwalim, a clinical officer with over 10 years of experience in the medical field. She has worked both urban and rural areas, treating a wide range of diseases, and has been a critical person when it comes to medical outreach programs that provide healthcare and understanding to communities. Ruby, karibu sana. Now, can you please introduce yourself? I gave just a bit of who Ruby is, but introduce yourself, tell us who you are, why a clinical officer, and what is it about working with communities that makes you feel fulfilled, if it does?
My name is Ruby. I am a clinical officer with more than 10 years experience, working both in rural and urban areas, and in the urban areas, both in the affluent and the less than affluent areas. In the rural regions, I've had the opportunity to work at the grassroots in the communities, have experienced both the neglected tropical diseases, communicable diseases, non-communicable diseases. And having worked for more than 10 years, I have had insight on the effects of such illnesses or ailments on the community and what it can do to their future or their children. So I'm happy to be here to share my insights.
Nice. I'm very excited for you to be here as well. And I think the first thing I'd want us to do is I'd want us to give the audience an understanding to what NTDs or neglected tropical diseases are.
So we can use the definition as it is. Alafu from that definition, we will get to understand what it is broadly, because what it means is in the definition. So neglected tropical diseases are a diverse group of communicable diseases that prevail in tropical and subtropical conditions in 149 countries. They affect more than 1 billion people that cost developing economies billions of shillings, dollars, every year. So as that definition says, haya ni magonjwa yenye yamepuuzwa. They're neglected. They affect mostly the communities that are mostly in the poorest populations, yes. So that's why they don't really have the spotlight on them. So they're neglected, yes.
Okay. And there's somewhere that I read that, and I think you mentioned it, more than 1.5 billion people worldwide require treatment for at least one NTD. Yeah. Yet, they're often ignored by the global health discussion. I mean, 1.5 billion is a lot of people, right? And on top of that, if not treated, they cause a lot of long-term diseases, there's a lot of stigma, there's a lot of fear. So why is it that the global health is not prompted by these 1.5?
They are, the NTDs are they usually overlooked because they unfortunately usually affect the less than prominent areas, yeah. They affect the poorer population of the world. And they are also not very, you can't really make a lot of money out of them, unfortunately. Yeah, it's not like malaria or HIV. Yeah, these are tropical diseases that affect specific regions that most of the affluent people don't really go to unless they're going to do, charity work. Yeah. So that's why they're mostly not in the spotlight as it is. Yeah, in as much as they're affecting 1.5 billion people, these are not necessarily the people that would be worried about it getting to them until recently. Yes.
So can we say that NTDs don't have return on investment?
Oh, yes. Back then, but now with the global economy opening up, a lot of tourism, it's more, people are traveling left, right, and center. We see people driving all the way from UK to Cape Town, and they'll go through these areas and they'll get the NTDs, and then they'll be like, huh? They exist, eh? Yeah, so that's why now, in fact, this year will be the first international conference for the NTDs. Yes.
Nice. Okay, that's a breakthrough.
That is a breakthrough.
Okay. And maybe I could read you all some of the most common NTDs. They are and you can please correct me.
It's fine.
Trachoma,
Yes, trachoma.
trachoma, bilharzia, soil transmitted belmethane infections. Yes, lymphatic filariasis. Wow. Clearly, you know that I'm not a medical professional. Onchocerciasis. Okay. So onchocerciasis is river blindness. Dengue fever, something that I didn't know, that it's also a neglected tropical disease. And I say this because I come from the coast region. So to us, we didn't think that it's neglected because we're like, oh, it affects.
But it affects people from the coastal region. Yeah, it affects people from the coastal region. Someone from Nyanza may not know what that is.
Really?
Yeah. They just know hiyo ni malaria ya Mombasa.
Yeah, Mombasa.
Yes.
Okay, interesting. And then we have the Chagas disease. So what's the Chagas disease?
Chagas disease, let me give you a definition. Basically, it's actually a life-threatening disease. It's caused by a protozoa called trypanosoma. That's a mouthful. Yes, and it's actually it's mainly endemic in the Latin areas. Yeah.
Interesting.
But it's also in Kenya. No, not in Kenya, but in the Western African region. Yeah.
Okay. And based on the NTDs that I've read out, or even you've mentioned, which is the most common NTDs that you've come across with closely through your work?
Trachoma. Yeah, it's the #1 leading cause of blindness. Yes. Bilharzia. Schistosomiasis. Schistosomiasis. Yeah, rabies. But I think I've only come in touch with one rabies case, and definitely dengue fever. Dengue fever. So many cases of dengue fever, but initially we didn't know what it was called. Again, ilikuwa homa ya Mombasa or malaria ya Mombasa. Yeah, those ones up close and personal, those, And then there are those that we've just heard of. I think everyone has heard of leprosy. My 9-year-old daughter has heard of leprosy because the Bible and stuff, but I've never seen a leprosy case in my life.
Yeah. And what would you say was the biggest challenge when you came across these diseases and you were working with the community? What is the community's biggest challenge?
Okay, let's say like trachoma, as I've mentioned, it's the #1 cause of blindness, right? Unfortunately, with such kind of side effects like blindness, the community tends to to wanaficha. There's some kind of stigma that comes with that kind of effect of a disease, right? Most of them think it's a curse. Yeah, wanajua ile village wanakuanga cursed. Sana sana wakifika a certain age they go blind. Yeah, they don't know that it's actually a disease that if detected earlier, it could be treated. Yeah, so that's one of the challenges. Even leprosy, because actually most of the NTDs have very severe side effects, very debilitating. In fact, some of them cause disabilities. Now, like we said, blindness. Some of them cause paralysis. Yeah, so in most communities, the challenge is they hide their relatives that have these kinds of illnesses because of the effects that they have, on their families and communities. Yeah.
So tunaweza kusema kwa haya magonjwa yanasimamisha maisha ya watu wengi sana, jamii na pia yule mtu ambaye anaathirika.
Yes, na mwenye anaathirika, yeah. Because once you go blind, you won't be able to, they think that once you go blind, hautaweza kwenda kutafuta kazi, kuleta mapato, kuwezesha familia yako, feeding your family, educating your children. And that's why now, if it's a man who's affected, ataachwa to fend for themselves. Maybe the wife will go marry someone else. Or if it's the wife, ataachwa na watoto wake. Yes, yeah, so.
Right. So I want us to talk about stigma, awareness, and also access to healthcare, because this is very important. And one of the major challenges of NTDs, it's usually stigma, as you've also mentioned. How can we change that? How can we help communities to change their mentality on how they view these diseases?
First and foremost, I feel like communication and information is very important. Once you have put the information on the ground, it will be easier to go from there. So one, make sure you educate and create awareness, have awareness campaigns in the community, have them know that their community has a certain NTD that they may be battling. Yes. Once they have this information, second will be engagement. So have them bring people who are affected by such NTDs, yes, or if symptoms occur, because once you give them the information on how the disease presents itself, how the symptoms occur, how to prevent it, the engagement will be in such a way that wakiona such symptoms or whatever, they'll be able to report either to the nearest health facility, to the chiefs or whoever is on the ground. Then support groups. Yeah, those already affected probably by disabilities such as blindness, disfigurement. If they have support groups, it will be easier for them to move on in the community without feeling shunned or stigmatized against. And support groups could also include those not directly affected, members of the community who will help those affected to integrate back into the community. Advocacy, of course, and policy change. So once there are policies in the ground and once you advocate for such NTDs, it will also trickle down into the community or into the grassroots to help them cope with whatever challenges that the NTDs they are facing bring along. So those are just some of the things that we can do.
Tunaweza kuhakikisha vipi madawa, madaktari, clinical officers wanaweza kufikisha ujumbe na pia katika hizi jamii?
So I feel like using social media platforms, definitely. I think every professional, be it daktari, lawyer, walimu, wako kwenye social media. So creating that awareness through a platform that has such a wide reach is one of the very key ways of putting the information there. Now, when it comes to us doctors or clinicians or nurses, capacity building and training by the government would really go a long way. So kama mimi personally, I came across NTDs when I was probably in college. Yes, tukizisoma. Second year, I think. Alafu kishamaliza, if you don't see it again, hiyo imekutoka, imeenda hivyo. So imagine being posted in a community that, yes, that faces a certain NTD. In fact, when we were being taught about them, we didn't even know they were NTDs. They were just protozoal infections or parasitic infections. They weren't classified as neglected tropical diseases. Yeah. So it would be best if the government would build the capacity of those that have been posted in these areas that are affected by various NTDs. Umepostiwa mahali kuna sleeping sickness. It will be in your best interest as a clinical officer working in that community to be trained on how to deal with certain issues that may arise when it comes to sleeping sickness, how to diagnose it, how to treat it, and what to do to prevent it. Yeah.
Okay, that's good. And I want us, and you've talked about social media, so I want us to go into the role of technology, social media, and the most important thing, which is storytelling when it comes to NTD awareness. So the Escape Neglect campaign, it emphasizes a lot on storytelling and localized content. Why do you believe this is very important, especially right now when it comes to the NTDs?
I feel like it's important right now because everyone is on social media. Yeah, I feel, not everyone, but more often than not, there's always a way in which someone will just go onto a social media platform and get information. Even in the most rural of areas, they're creating TikToks.
Absolutely.
Yes. Yeah, it's called Kenyaji TikTok.
Yeah.
It's
But
there.
it's getting the message
Exactly.
out.
So imagine using such platforms to spread the word on NTDs. Yeah. So I think that's why we're using technology. Not necessarily just social media, even radios. Our grandparents use radios, they listen to news. Imagine if campaigns and advocacy messages were done through radio. Yeah, exactly. It would go such a long way in spreading awareness on these NTDs. Yeah, so that's why I think it is very important. Yeah.
Na wajua tumekuwa tukiongea kuhusu NTDs, role ya social media, madaktari, policy na nini. Unaweza kutupa mfano wa campaign moja ambayo unajua ama umefanya ama umesikia ambayo ime amplify NTDs sana na ime create awareness na jamii kujua kuhusu haya magonjwa na vipi wanaweza kuendelesha na kuboresha maisha yao?
So actually in Kenya, we have a division for neglected tropical diseases. It's been there.
Okay.
Yes. It's under the Ministry of Health.
About this, but there is a division for neglected tropical diseases. The Ministry of Health.
Yes.
In Kenya.
In Kenya. And there's also a division for trachoma elimination. So it's called the Kenya Trachoma Elimination Program. And it aims to eliminate trachoma by 2026. Okay. We're in 2025.
So we have a few months left.
Yes. Yeah, there are various campaigns that have been set aside, including initially leprosy was under TB. Okay. Yes. So
those two are two different.
Totally different.
Diseases, right?
Yes. So it was TB and leprosy. Yes. Yeah. So there have been campaigns. There are divisions in the government to deal with NTDs because in Kenya, NTDs are real. They happen. They will affect the relatives of those in government, whether they like it or not. Because unfortunately, Kenya has a large number of marginalized communities. Absolutely. Yeah, so there is a cross-border collaboration with various NGOs to help in tackling trachoma because, as I said, it is the leading cause of blindness. Yeah. So, kuna campaigns kadhaa ziko. Okay. Yeah.
Okay. So I want us to focus on prevention treatment and breaking the cycle. And when it comes to breaking the cycle and treatments, are there any affordable treatments that are available and accessible to communities that are heavily affected by the NTDs?
Unfortunately, the treatment options may or may not be there, depending on the community affected. Let's take, for example, Budalangi. Everyone knows Budalangi for floods.
Yes.
We don't know what they go through after these said floods. They're one of the regions affected by NTDs. Do you know which one they're affected with?
No.
Sleeping sickness.
What?
Yes.
Budalangi is affected by sleeping sickness?
Yes.
I didn't know that.
Yeah. So the drugs may or may not be there because of accessibility to that area. So saa zingine utapata madawa yapo lakini expiry date, short expiry. The drugs are not expensive, honestly speaking. Most of these drugs are not expensive, but are they in the grassroots community health center? No, not often. Yeah, so you may go to a health center, hakuna hiyo dawa. You'll have to be referred to the next facility, which is probably very far away. Yeah, so unaona mtu mwenye ako affected, by the time anafika kule anaona, you know what, let me not bother. Yeah.
Yeah. And speaking of sleeping sickness, I think before this we had talked about it. I spoke about sleeping sickness in a very light weight. Like, I did not know how serious sleeping sickness can be. So maybe since you've talked about it, how serious can sleeping sickness get? That can it lead to death? Can it lead to losing other things in the body? Please let
sleeping
us
sickness is very serious. It can lead to death. Yeah. So si ile ati uko tu na usingizi 24 hours. Okay, yes, uko na usingizi 24 hours, but it's debilitating in the sense that you can't eat, you can't function. Yeah, so imagine you're too sleepy, you just can't do anything. So you'll definitely get malnourished. You can't take care of yourself. Yeah, eventually it can lead to death. Yeah, because you're not you can't even go to work. Yeah.
Yeah. Okay, and are there any prevention strategies that you think are simple when it comes to actually NTDs that some of our audiences could actually use to help a few of their relatives or themselves if they find themselves in such situations?
Yeah, most NTDs are caused by vectors like mosquitoes. Yeah. So something as simple as a mosquito net could go a very long way. So provision of nets. Something else is hygiene, basic hygiene, hand washing, because other NTDs are spread by protozoa. Uchafu. Yes. So hand washing, by hand washing, providing clean water, soap, sanitizers. Other things are like, since we've said mosquitoes, just clearing bushes, to prevent for vector control. Yeah, so some things can be done by the community itself. Yeah, that's why you need community participation. Make them aware so that they can participate in their own well-being. Yeah.
Sasa serikali na watu binafsi wanawezaje kuungana ili kusaidia katika hili janga ambalo tunaloongea?
Okay. Kama serikali yenyewe, they already have a division. Yes. So ensuring that they set up tangible, like campaigns that actually help the community. Like Kenya has had NTD conferences.
Oh wow, really?
Yes, they have had them. Okay. I think 13 annually. But zinafanywa Nairobi, wataenda Mombasa.
Far reach from where
things are actually happening. Go to that community and have a campaign of that specific NTD that affects that region. So if you're going to Budalangi, rally every sector, government, whatever, and then ikule, do the campaign there. It really helps, Next time, do it in some other part of the country. Like, you remember Jiggers?
Yes.
Yeah. everyone knew about jiggers because the campaigns were, you know, yes, walikuwa wanaenda huko, wanaenda paka Nyeri. So how come there are no campaigns going to these other regions that are affected by NTDs? So it would be in the government's best interest for the communities, for them to decentralize their campaigns. Si lazima waende KICC. Yeah, they can literally just go to the community and see firsthand what the NTDs are doing to the community, the effects it's having, and what they can do, yeah, about it.
So I want us to go into the call to action, yeah? And you talked a bit about what people can do. So as an individual, whether it's Nadia or somebody listening, how can they protect themselves and their communities from this? Now, on a practical way, these are people who are not aware of, you know, medical terms, but just the practicality of it, whether it's on ground or even off ground. What can individuals do?
So as we've said, most community members in the areas affected by NTDs already know there's something that is affecting them. So first things first, create awareness. Let them know what it is. It has a name. Put a name to whatever is affecting them. Once they have a name, give that thing a body. What is it? Umeshawambia ni hii ndo ina affect. You can't leave it there. So what is it? Ni hii ina affect hivi, you know, it can cause disability, it can cause if not treated. Yes? So once they have the body, teach them about prevention. So hapo kwa ground, prevention, bila kujua maneno mengi. Nawa mikono ukitoka msalani, nawa mikono kabla ukule, you know, once you touch someone affected, or, you know, just hygiene, first and foremost. Second, ukienda kulala, weka neti. Doesn't necessarily have to be rainy season, yeah, because some of these things, haujuangi, it could be, yes, you can't control, but again, we can, because putting a mosquito net can go a long way, yes? So hapo kwa ground, there's so many things that can be done without necessarily having technicalities, yes, those technical terms. So I will always go back to communication. Make sure they have the information. Once they have the information, it will be very easy, even for them as a community, to take part in helping themselves against the NTDs. Yeah, communication is key. Yeah, it's key in everything.
Yeah. And so I think with that, I can even echo what we can do generally. As it is right now, I'm sitting with Ruby here and we're discussing about NTDs, something that I had no idea about. Some of the diseases that we discussed are in my community, but I really took them very lightly because I didn't think, you know, they can endanger someone or stuff like that. So I think it's what you can do when it comes to getting involved with the Escape Neglect campaign is by sharing this particular conversation we are having, but more so check out what else is being done there. She already mentioned that there is, like in Kenya, there is conferences that happen when it comes to neglected tropical diseases. Do you know about them? Do you know what it is? You can find this information online. And then also communication. When you go for Easter, or when you go for Christmas, or Eid, or when you go for Diwali to your communities, maybe it's time for you to pay attention to what is happening within, you know. You could even visit your chief or even your MCA or somebody and find out, or even your neighbor, just to find out what is going on. And then from there, because you're at a vantage point, read about it and see how you can demystify that, because I think it's very important what you talked about. Na swali langu lengine ni sasa tuliongea kuhusu serikali, kuhusu mtu binafsi. Kuna NGO nyingi, non-governmental organizations. Kuna watu ambao wanafanya biashara sana. Hivi vikundi vinawezaje kubadilisha approach zao when it comes to mambo za NTDs? Because wanafanya kazi, lakini tunaona bado hakuna maendeleo. Wamelegea kidogo. So vipi wanaweza kujiboresha?
I would... Mimi, kama Ruby, I'm talking to an NGO out there. Don't think about the money first, because unfortunately, in my opinion, Yeah, it's always what is the economical vantage point of them campaigning towards or against something, right? But I would urge them, usieke mbele pesa kwanza, look at the community affected. Collaborate with the government to have campaigns, posters, yeah, the way kick polio out of Kenya, malaria, HIV.
HIV. I think
Yeah,
they did a good job.
good job with HIV.
As millennials, we were scared.
Hey, we were so scared of HIV.
I feel like they need to bring that back.
Yes,
Yeah.
they need to bring it back, and also now let the NTDs ride on it. Yes,
Okay.
so because people with NTDs, if they have HIV, their prognosis goes towards the poorer side. Yeah, yeah, because this person is already at a very poor advantage, okay? Already tayari ako kwa hiyo situation yenye immunity yake iko chini. Yeah, so incorporation of NTDs in other campaigns like malaria, because malaria, mosquito net, nini, hizo zote ziko hapo. What about, yeah, you know, something like sleeping sickness? I know I need a mosquito net for the same, but it's called a mosquito net. Yes, so mosquito net ya malaria peke. We can use the campaigns already on the ground to boost the NTDs into the community. So NGOs, you can work on your campaign strategies, having posters, visiting schools, because also pia ukianza na wale wachanga, it is easier for them to grow into awareness. Yes, so anajua nini ina affect, what can be done, and how to live with if it ever happens, how to live.
And my question is to you now. If there was one change you would like to see when it comes to NTDs and the fight against NTDs, what would that be? You can.
I can speak to that. Yeah. There's already a division on the ground. But unfortunately, the work is not seen in the community. So a division, for there to be a division, that means there is funds allocated for these NTDs. So kila mwaka, finance bill, kuna pesa inawekwa kando, inaenda kwa division of neglected diseases, neglected tropical diseases in Kenya. So if these funds could trickle down to the community, yes, to those people who are actually affected by the NTDs, it should go down even to the medics who are handling these people affected by the neglected tropical diseases. It could go down to providing medication, providing the nets, providing the hygiene, like soaps and sanitizers, making sure in the grassroots kuna uwezo wa kujisimamia, because there's no need in having a division na mtu kwa ground feel your effect. So it should trickle down. Yes, it should trickle down. So it would really be, mimi kama Ruby, I would be happy if the funds allocated to the NTDs actually do their jobs. Helping capacity building for the medics on the ground, equip the hospitals both with medicines and beds, yeah, and campaigns in the community. Yeah, hapo nitakuwa sawa. Yes.
And you answered a question, because as much as we have these conversations, we always forget to talk about the medics, the health, people in healthcare, and we sometimes can discuss about these things are neglected, these diseases are neglected, but we also fail to understand that also people in the healthcare are neglected as well, because we are talking about neglected tropical diseases, but we need professionals to come in and help when it comes to awareness, when it comes to medical services and everything. So if we don't empower them, if we don't support them, then we still go back to zero mileage. Yeah, we're not doing anything. And so I think you've said it all. So what would be your call to action as we close up, knowing that now globally neglected tropical diseases have so much traction? what would be your call to action?
I feel like there need to be more noise about it.
Yeah.
Let it be on TVs, let it be on billboards, let it be on newspapers. Let me log in and see an ad for NTDs. I'm tired of seeing food ads. Let me go on YouTube and actually an ad on a neglected tropical disease pops up. Yeah. So anyone who has the capacity to help in spreading the word, spreading awareness, please, yes, do the needful. Let's put it out there. And you've said the doctors will need to be given capacity building. Also teachers.
Teachers. Okay,
yes.
Why so?
Because, as I've said, inaanza uko chini kwa grassroots, watoto shuleni.
Yeah.
If a teacher is also trained on identifying various diseases, various NTDs in their communities. And what I notice kuna absenteeism. Unajua mtoto yes, they can report to the village elder, which the news, you know, if there's a community health volunteer, ataenda kule ende aone kama ni mtoto ni mgonjwa, mtoto ameshinda hakuji, ama suddenly they're losing of sight. Yeah. So once a teacher is also trained on identifying these things and disseminating information on the same, si lazima mtu afike kwa hospitali. Actually, inakatikia hapo. Yes.
Okay. Sawa. I hope mumesikia. So this has been such a fruitful, insightful, well-packaged conversation. Ruby, thank you very much for the insights you've given us, the practicality. Na wajua kuzungumza Kiswahili hapa na pale umejaribu kidogo. And asante sana for sharing expertise. And I think from me, I would say like we also appreciate the fact that you are part of the people who has encountered certain NTDs and has been part and parcel of it. And so it's very important for us that we had this discussion because I needed people to understand what these neglected tropical diseases are and the urgency to it. So asante sana. Thank you so much for participating. Na kwa nyinyi nyote, magonjwa ya tropikia yaliyopuuzwa yanaathiri mamilioni ya watu kama nilivyosema. Lakini kwa pamoja tunaweza kusaidiana kuvunja huu mzunguko wa uambukizi wa haya magonjwa. So tafadhali shirikiana kwenye mijadala mengi ambayo yafanyika ikiwa ni online ama katika vikao ama kwenye jamii zenu, waambie marafiki zenu, support madaktari, familia ili tuweze kuendeleza this awareness that is out here. And if you really found this episode very valuable, make sure that you subscribe to my channel, Nadia Abdallah, on YouTube, and look for the African Power Hour on Instagram. Follow True My Voice and Devex on all social media platforms for more updates and resources on NTD awareness. And my call to action would be follow the campaign, share the message, spread the awareness, but also be realistic when it comes to participating in it. As Africans, we all have a responsibility when it comes to certain diseases, in this case, neglected tropical diseases. Each and every one of us might not be affected directly, but you know someone from your family, from your neighboring community, or within your community that is affected. Let us stop stigmatizing this issue. Let us start embracing these neglected diseases as things that could happen to us. And more so, let us communicate and be in touch with healthcare and medics on the ground, because these are the people that we need when it comes to amplifying the awareness for neglected tropical diseases. Personally, I learned a lot. I enjoyed the conversation. And honestly, being a mentor at True My Voice is one of the most fulfilling things that could ever happen to me. So I look forward to engaging with you all, and be sure to advocate and campaign when need be. I'm your host, Nadia Abdallah, and this is the Africa Power Hour. Till next time.